is pretty heavily inspired by one that Sebastian Kosciuszko came up with, and he showed us. We had an intern group working on that during the summer, and he was kind enough to show us around how everything worked. So if he's going forward with that and our efforts on that side yield fruits, then we'll just have these like 5-liter modules that cost between $50 to $100.
What? That's absurd. Really? Hi, everybody. Welcome back. Today I'm here with Anthony from Open Insulin. So we're highlighting again some really awesome projects that are coming out of the community. And one thing that I always preach whenever I speak to somebody brand new is Open Insulin. So Open Insulin was born out of your backyard, Anthony, and has been proliferating in Oakland, California, and now has spread globally throughout the world with people, lots of biohacking spaces picking up this really cool project, lots of collaboration being done. There was even a Time magazine spread on it. So yeah, it's a really great project. I highly recommend you check it out. And I met Anthony maybe like a couple of years, maybe like 4 or 5 years ago, kind of at the beginning of when I started joining the community. And yeah, he's a really great person, point of contact. He's very passionate about like his project and especially helping the community. So welcome, Anthony.
Thank you very much for all the kind words and excellent introduction.
Thank you. So tell us more about Open Insulin. Let's say, how did you get started on this project?
Well, Open Insulin is, as the name is meant to suggest, an effort to make insulin open source. And there's a number of concerns around really urgent social problems and access to insulin and medicine in general that created the initial impetus for undertaking this project. And we're also drawing on the strengths of the biohacking community and kind of the hackers and the hacker ethic in general of seeing a problem and just getting down to business and figuring out how to solve it in the most direct way possible, and being creative and resourceful and thinking outside the box to do that. So as you may know, as many people may know, but as also many people aren't aware yet, there's a really serious crisis in access to insulin, both in the United States and globally. A recent study found that about a quarter of people who need insulin to survive in the US have rationed it at some point. So that's millions of people, even here in one of the wealthiest, most developed nations around. It's one of many issues with how healthcare works or fails to work around here is just that the system for producing and distributing medicine is really complex, and it's full of perverse economic incentives, and a lot of people fall through the cracks of the system and don't end up with access to the medicines that they need to survive. And diabetics who need insulin to survive is one of the largest, most significant groups of such people. So also globally, it's an even worse problem. About half of people globally who need insulin to survive don't have access to it. And that gets into even more complex issues around the legacy of colonialism and how a lot of places around the world just aren't profitable enough from the perspective of the manufacturers, to get their attention, their priority in making products available there. And there's infrastructure issues where you need like roads that can carry refrigerated trucks to carry the insulin. So there's a lot of places that just don't have that kind of infrastructure, and they get shut out, any people there who need insulin or are out of luck, unfortunately, or they end up going to like the local gangster or something really, it gets weird and it gets complicated. So in order to address all of this, we various people in the community about 5-6 years ago, including myself, noticed that we were working in a lab and we were making proteins, or people were making proteins in labs similar to our own for various purposes. And insulin is a fairly small protein, so why couldn't we make it and figure out how to make that not just be like a cool demonstration, but something that could actually go all the way to addressing this problem and providing people with the medicine they need to survive. And so we are kind of combining the open hardware push in biotech equipment with the community organizing aspect of the biohacking community. And we're looking at expanding the portfolio of open source systems of organisms to make the proteins and enzymes that we need to make insulin, and also the equipment for protein production and purification, like bioreactor, chromatography setups that you need to actually get the insulin out in a pure enough form to formulate and use as a medicine. And then we're combining that with small scale cooperative structures that will make sure that there's no principal agent problem where you have a company that's trying to profit off of sick people. Like the people who are using the medicine will be the company, so there won't be this conflict of interests in between the customers and the owners and the operators and managers of these entities that we see at the roots of a lot of the problems in the existing system.
Right.
So it's bring together a tremendous number of different ideas to try to create this new in terms of what we're familiar with way of doing things, but something that in a lot of ways is more similar to how things were done in medicine in like the 19th and 20th centuries, where you had like local organizations like the lodge or the club of this or that would just be a couple hundred people, and they would pool their resources, hire a doctor, give everyone health care, provide a kind of insurance for each other. So if someone wasn't able to work in the workman's home or something, they would get a pension from that. And you don't really need like a national or global mega corporation to do any of those things.
But we do today.
Well, they'd like us to think that it's necessary, but it really isn't. And the crux of that we found is like the way that the drugs are produced for the clinical trials that many of these global mega corporations are running is done in a small CMO that is working at the same contract manufacturer that is working at the same scale that we're looking to set up our own production facilities at. So it's not just that it could be done, it's done every day for the very same drugs that end up being produced at global scale. Like before they're produced at global scale, they're produced at the small scale so that they can do the trials. So
then what makes your trials kind of different than, because there's lots of patents surrounding insulin, and especially at large pharma companies, and they always want to keep that protected. Like, what is Open Insulin doing differently than large pharmaceutical companies' formulation of their drug?
Well, fortunately for insulin, the situation around patents is not that bad. The state-of-the-art forms of insulin that I use and that many people use that doesn't involve any compromises. This is the best stuff out there. Those were developed more than 20 years ago, and many of the patents that apply to those have already expired. We had a preliminary patent analysis done, and we found that most of the ones that might apply to ours were either expired or we could easily work around them. And there might be possibly a couple more that might apply that are expiring in the next year or two, and that's it. So
Nice.
um,
That's awesome. So
yeah.
not only do you have to tiptoe around, but you can literally take the patent away or reformulate it in some way where it's just like newer and better. That's really great to hear, actually.
Yeah, and if we weren't kind of lucky in that respect, it would be a whole different story, because quite a few drugs that people rely on are still caught in this, thicket of patents, and the patents themselves. It's just an area where it can be so much uncertainty around whether you're going to actually encounter a problem that will derail your whole effort, that most people don't even try just for that reason.
Totally.
Especially
Yeah.
when there's like big investment dollars at risk there. So that's another thing that we are able to address, is we are working at a very small scale. We don't need a lot of capital to get rolling. We just need uh, elbow grease and people who either have the skills or are willing to learn the skills and are just willing to put in the time, and then we get it done that way.
Yeah. A big question that a lot of people ask me in regards to open insulin, and maybe you can address it to our audience here, is so what's the point of open insulin? Like, is the point to just have huge vats of insulin in your like garage or basement, like just for use for yourself, or like what is are you like like does it have a higher message of like insulin's really expensive so you can produce this in an openly sourced manner? Like, what are your thoughts of what you're trying to achieve with this project?
Well, like many people, I think it would be really cool if you just had, like, next to your Mr. Coffee a little Mr. Insulin, and you could, like, hit the button and it started making it, or whatever peptide you want. And that is actually something that a number of academic and even military projects have looked into, because they have the concept of, like, well, you're on a battlefield or you're in space or something, and you're in the back of a van and you need to make the drug. And instead of having like every drug that you need, you just have like a library of organisms or something, and you like put it in and hit the button and it goes. And that's a really cool concept. It is something that hopefully we will see in our world in our lifetimes, or in the decade or something. It's a new decade. But uh, that's not exactly what we're working on now. It may be that what we're working on now kind of feeds into that, and that we're making open source, small scale protein production and purification stuff. But what we're doing now is not for your bathtub or the countertop of an individual or a household. It's going to work at the community lab scale. So we're looking at organizing some sort of a cooperative enterprise, most likely not for profit enterprise, or at the very least something that is owned and operated by the people who use the medicine, and they make the decisions on how it's run, where the money goes, and all that. And it's something that at the lower end of the scales that we're looking at could serve a few thousand people, like 4,000 or 5,000 people. And it's something that could pretty easily be scaled up to serve a few 100,000 people without increasing the complexity of it too much. We are in the early stages of this, but we have like a modular bioreactor design that is pretty heavily inspired by one that Sebastian Kosiova came up with. And he showed us, we had an intern group working on that during the summer, and he was kind enough to show us around how everything worked. So if he's going forward with that and our efforts on that side yield fruits, then we'll just have these like 5-liter modules that cost maybe between $50 to $100.
What? That's
Parts.
absurd. Really?
Well,
Wow.
he's got his down to like under 40 apparently, or the last time we talked to him. So when we did the bill of materials, it came out more like 120, but like big deal, right? Like,
Wow.
so it's just could be something like, it's like going from the mainframes to the server racks in computing. You have these things that used to cost millions of dollars, and you're just replacing them with things that cost hundreds or thousands of dollars.
That's
But
incredible.
more.
I mean, like, yeah, but bioreactor is literally just temperature control and then feed controls, and then you can make
Yep.
just like really novel things, right? And I mean, I'm a metabolic engineer, I'm a genetic engineer, and I used to work with fermenters, like big reactors and stuff. Yeah, it's definitely the future of producing something more renewable and sustainable with just like sugar and water. Like it's insane what you can make from microorganisms that's been genetically modified to make insulin. Like what an essential thing for humans to be just produced in a bioreactor. So that's really cool that it's like $40. That's nuts. I hope you guys can teach other people how to like make their own bioreactor and possibly have their little like Mr. Coffee maker for drugs in the future. That'd be really cool.
Yeah, I'm sure if we all pitch in and move this technology forward, then we'll have that. That can easily come out of our community. But I think actually it was posted in the Facebook group. I think Sebastian posted it last year, so should have a look at
Okay. Yeah, I'll
And
definitely have a look at
I haven't
it.
talked to him in many months about it, but I need to catch up too.
Yeah, for sure.
But we have developments going on in our hardware group on the protein purification system as well. So we have like about half dozen really active bona fide engineers who are doing a great job, and we're just kind of like going down the list of things, like sourcing the pumps and the microcontrollers and architecting the software and everything.
Yeah.
So that's coming together too.
Who's in
And
your group right now? So I mean, it's operated out of Counterculture Labs, but what other groups have adopted open insulin?
well, we have some good news recently, which is that our Baltimore chapter, which is based at Bugs, a Baltimore underground science space, and that's where Jan and Louise moved last year. So Jan is our chief scientist, and Louise is our communications lead, and they are married to each other. And he's got a job at Johns Hopkins, so they moved to Baltimore and got established there. So that was like a really fortuitous way for us to expand the network. And they just got a grant based over there that the whole organization is going to be helping out with to actually set up a pilot production facility in Baltimore to serve people in Baltimore. And we haven't officially announced that yet, and we didn't do the press release and all of that, but that is something we're going to announce soon. And it's great news, and we'll hopefully in the next few years, as a result of that, have people in Baltimore using insulin that we made.
Wow.
There's a lot of steps still between where we are and there, but we were able to come up with good strategies in the course of preparing our proposal for that grant for some of the most difficult questions, which is how to not just make a safe and effective product, but one that is approved by the prevailing regulatory authorities.
I got shivers, and not just because the weather in California is freezing right now, but that's really great. That's fantastic news. Like, could you imagine, like this is proof here right now that we see a biohacking project come out of the community, and now it's going to be, it's getting grants, it's getting funded to do things that we never thought could be possible, and to be brought in the hands of people that need insulin. That's pretty insane. Like I really give you massive kudos, Anthony. Like, congratulations.
Yeah, thanks. Like, fortunately, we've always had a ton of really talented help helping us to navigate all these difficult questions that are technical and legal, and even just like at the level of like history and understanding of how society works at a very high level, and how all of these systems that produce the problem are structured and support themselves, and how we can develop an alternative, just like going from like engineering organisms to hardware engineering to like social sciences. We've had just people who see that it's important, see that we can do it, and have just said, all right, I'm pitching in.
Nice. Well, that's amazing. Your project's definitely a benchmark for biohackers alike, especially people in this group. So that's pretty awesome. My last question to you is either a personal question or a generic question. But what does biohacking mean to you?
Well, for me, like I got into biohacking through just like hacking in general, and when I was a kid back in Cleveland, I would just like go and dig out the 2600 magazine from where it was hidden in the bookstore and like read the politics section, and like I just always was like, yeah, that's how we should do things. We should just do them, and we should do the right thing, and we shouldn't let anyone tell us not to do the right thing, and we should share, and we should collaborate openly. And that led me to get involved with like hackers and biohackers specifically when I came out to the Bay Area. And for me, it's always been us like taking care of each other and helping each other to just like do the coolest things that we can. And sometimes that is addressing a really like urgent material need of people are going to die if they don't get a certain medicine, or sometimes just people have a creative vision for something really, like we want to paint with bacteria. It's just cool. Like
Yeah.
you engineer the bacteria to make pigments, and you put them on the petri dishes. Like the whole there's just this whole spectrum of creative possibilities where we can help each other out, and the knowledge of how to do what we're doing is in our community. It's shared in our community. It doesn't come from on high from some very elite institution. And actually, we get people coming out of those elite institutions, like the big university and corporations, who are just kind of fed up with how limited it is in those contexts to be able to pursue just about anything other than the very specific thing that they're incentivized to pursue there. And so we're able to bring together like people with the background and the skills that they cultivate there, and we're actually creating an environment where you can now get the same kind of I have to choose my word carefully to say exactly what I mean, but you get something like a community apprenticeship. It's like going through all of the bureaucratic hoops to get your credentials and move up in that world. Like you just kind of come and we all kind of grow up together in our community. So that's
Yeah.
what I value most about it, is that we're able to do that.
Yeah, and hey, it takes a village, or I mean, in this case, a community to really build something like this. So I'm really glad that your group is really laying down the foundation and the pipe work for, future projects to come out of this, because not only is it insulin, but it's like obviously other medication, lots of renewable chemicals. Like there's lots to come out from the bioprocesses of fermentation and synthetic biology. So yeah, it's pretty cool. So another question is open insulin open for collaboration? Like, can anyone join your project?
Yeah, absolutely. So we're just now setting up a formal organization for the Open Insulin Project specifically, and we're going to have more formal membership processes and requirements. But even after that, I think a lot of it will just work the way it does right now, which is just come to the meeting and get to know everyone and see what's going on and take something that we're working on for yourself. And that's how you get involved. And it's about that simple. And everything I just said is, in effect, like we're very attentive to make sure that new people can get oriented and become part of the group and contribute as quickly as possible. It's not to say we've gotten anywhere near figuring that out in any definitive way, but like you were saying a few minutes ago, we're trying to lay the groundwork for a whole new way of doing things. So a lot of that we've figured out, or a lot of that is part of the wisdom of the biohacking community and the hacking community. But a lot of that is still stuff that we need to figure out. We're looking at like cooperative businesses and how they're structured and how they're run day to day. And we're looking at a lot of different things. So if you want to come and help us figure it out and see it as it's being born, and then take that wisdom back to wherever you're coming from and whatever you're doing, then that's great. Or just, come and help us out in whatever way you can. That would be very much appreciated.
Awesome. Thanks so much, Anthony. Yeah. And, collectively, there's lots of backgrounds that come into Open Insulin just to help out, even on the social media side, like there's lots of roles to fulfill. And I hope you can get connected with Anthony and his project. So I'll go ahead and provide the link to Open Insulin to get you connected. But if you're interested in giving one of these talks with me, to pitch a proposal, be sure to email me. And lastly, join the Facebook community for the Biohacking and Genetic Engineering Design Group. We also made a Telegram just in case, things are getting deplatformed at the moment. So, cross-pollinate and whatnot. But yeah, thanks so much, Anthony, for sharing your project and your wisdom. And I hope people jump on board with this really cool idea.
Yeah, thanks for having me. And like you said, to everyone watching, we'd love to have you come by and say hello.
Awesome. Thanks so much. Take care. Bye.